Hi, good afternoon, everybody, and thank you for joining our Manchester Biomedical Research Centre Rapid Translational Incubator webinar. We've got a few people in the room here and about 10 of you taking part via webinar. So thank you for joining us on this day. Okay. So I'm Zoe Talks, Project Manager for the Rapid Translational Incubator team. And I've got next to me Professor Jackie Smith, who's your host for today's webinar. For those of you taking part remotely, I'm just going to check that you can all hear us and that you know how to communicate with us before we launch into our presentation. So on your screen, you should see a blue-coloured slide called Rapid Translational Incubator Network and Webinar. And on the top left-hand corner of your screen, you should see a little banner saying, "Now viewing Zoe Talk screen." And then on the top right-hand side of your screen is your control panel. If you click the white arrow in the orange box, this will expand the panel, and there's some things you can do to communicate with us. Okay, so you are all muted, so we can't hear you, but you should be able to hear us. And we'd love you to send in a comment or question as we're going through our presentation. So if you want to do that, you click on the questions bar on your control panel, and then you can type a question. The question comes to us here, but it's not seen by the other attendees. So we'll read the question out and answer it to everybody. So I'd just like to check that you can all hear us and see us. So please could you raise your hand using the hand tool on your control panel. Okay, thank you, Elizabeth, you've raised your hand. That's good, you can hear me. And Rich, oh, okay, Angelique. Anybody else can raise their hand? And Sarah, thank you for raising your hand. Okay, so thank you. So I think you can all see and hear us. Great. Okay, so let's start our webinar. And I'm going to hand you over to Jackie now.
Okay, so today's webinar is really just to give everybody a bit of an overview of what we're trying to achieve as the Rapid Translational Incubator cross-cutting theme of the BRC. What we really represent is the patient-facing part of the BRC. So the kind of studies that involve clinical trials in their early phases and experimental medicine in patients. And there's a great deal of support for setting up these studies and getting all the regulatory approvals that you need to do these studies around Manchester. But actually that support is not always easy to find out about. And so Zoe's been doing a great job of pulling this information together on our RTI website. And we also held a workshop just before Christmas where we actually got researchers to contribute to what's going on the website in order to allow people to share what they've found themselves from setting up studies locally. So the idea of the webinar is to extend the work we did in the workshop to form a greater peer support network. We've also put together some pathways, and Zoe's going to show you an example of one of these on the website. And again, we're keen to get feedback about these. So if there are other suggestions people have for help in setting up different sorts of clinical trials, please let us know so we can add to those documents. And we're also keen to answer any questions that people have. So we should go on to the next slide. Zoe? So the Rapid Translational Incubator has representatives from all the different themes of the BRC. So there's myself, I'm the theme lead, and I also work in the respiratory theme. There's also a group of colleagues, so Matt from Precision Medicine, Ben from Musculoskeletal, Carolyn from Hearing Health, Sasha from Cancer Prevention, and Richard from Dermatology. Many of the project managers from the BRC are also contributing to this group and the work that we are doing. And we're keen that the information that we're providing is useful not just to people working within the BRC, but beyond that too. So in addition to the BRC themes, we also have input from people like Laura Adjaram from Translation Manchester, from Richard O'Brien from the Manchester CTU, and also from our PPI and comms people associated with the BRC and with the CRF. And Health Innovation Manchester we're working with as well, and they're also closely working with Translation Manchester. Okay, if we could have the next slide. So this slide is just really to try and give you an overview of the quite large number of organisations that are involved in supporting research around Manchester and that can be particularly important in early phase trials. So right in the centre there we have, in the red circle, the Manchester Biomedical Research Centre, and the Rapid Translational Incubator, the RTI, really overlaps a great deal with the Manchester CRF. I'm also the director of the CRF. So the BRC funding funds research projects in experimental medicine and early phase trials, and the CRF provides a platform of staff and facilities to help deliver those trials. Hence we sit very much on the overlap of that. And then you can see surrounding those two main circles, we've got lots of other infrastructure. So we've already mentioned Translation Manchester, who are funded by largely by the Wellcome Trust, to help unblock translational pathways, particularly for Wellcome Trust researchers, but beyond that too. Health Innovation Manchester is supporting both the development of clinical research, but also its implementation through into clinical practice. The Wellcome ITPA has a similar role and is funding part of Translational Manchester in getting access for basic scientists through to clinical researchers, and again, fund specific projects to unblock translational bottlenecks. So we also have our NIHR funding, as well as the BRC and the CRF. We have the Research Design Service, which many people may have come across, can be very helpful for grant applications. We also have the CRN, which are funded by NIHR, who often support later phase trials, but not solely. Then for statistical support, there's the MRC Hub for Clinical Trials Methodology, which is based in Liverpool, but we have representatives of in Manchester as well. Then on the looking at more towards innovation and commercialisation of research, Trust Tech represents innovation within the trust and how that can be commercialised and intellectual property protected, whereas we have UMIP for the university. We also have the Manchester CTU, which can be essential, particularly in high-risk studies and in multi-centre trials, in order to help with the organisation and the delivery of those and make sure they're delivered to an adequate standard. And then finally, we also have MASC, the Manchester Academic Health Science Centre, which again has a focus towards implementation of research findings within our clinical practice. So a lot of different infrastructure here that sometimes people can find confusing as to where to find help for particular issues with their own trial. So as I mentioned, back in December, we developed a workshop which was attended by a real mixture of both clinical researchers, but also support staff such as project managers, all of whom were involved in setting up different sorts of experimental medicine studies. And as well as having some talks and some sharing of a variety of experiences in setting up clinical trials, we developed some pathways in small working groups for different sorts of studies, so including things like medical device studies, biomarker studies, studies for testing novel therapies, for repurposing of older therapies, in order to help pull together some of the kind of challenges that people were experiencing in setting up those trials and what the solutions might be. And it was really that workshop that suggested to us there was a great deal of enthusiasm for this sort of networking and support, and made us think that a webinar might be a good way of reaching an even larger audience of people who couldn't necessarily make it to a workshop on a particular day. One thing to emphasise is the key message on the slide here was that early communication with all the issues involved with setting up clinical trials is important. And that makes me think that having these pathways and seeing lists of the kind of support that's available and making contact at a very early stage is probably the way to avoid some of the difficulties with clinical trials. So hopefully people will find these pathways useful. You can find them on the website, and Zoe's going to tell you next a little bit about what these look like and how that's set up.
Okay, thanks, Jackie. Right, everybody, so we're going to show you now our pathways. So these are set up for different types of studies, such as experimental study or a medical device study or biomarker study. And we've broken it down into different sections: the support available in Manchester, the challenges you might incur with this type of study, and some of the solutions that people have found help them in the past. So I'm just going to click on this link now, which takes you to where these resources are on the BRC website. We go to the BRC website, and then it's on our, go to research, our research, and then Rapid Translational Incubator page. So here, Rapid Translational Incubator page, peer support network, and then you can click on this link here where it says download pathways. You click on that, and it will bring up these pathways. So there's about 7 slides in here. The first one is a summary slide, and then the next, look at different study types, experimental study, for example. And so remember, these have been populated by attendees at our workshop last year, and also since then by the various support organisations in Manchester. But they're very much a work in progress, and we really value comments or additional things we can put in, particularly in the solutions section. So I'm going to go back to the presentation now. Okay, so the first slide looks quite complicated, but you'll see the red column is all the support, some of the support that's available in Manchester, and where it's blue, you can then click on that to go through to the relevant organisation. Then we list some of the challenges that people have identified with that part of the study, and then some of the solutions that people have found really helpful. And to make it a little bit easier, we've broken it down into the different stages that you might go through when you're setting up a study. So the concept, what you do about governance and sponsorship, funding, preparation, which is like getting ready to start, contracting, and then actually starting at a site. So I say in that document, the first slide is the a summary page, and then you can look at different study types. What I'm going to show you now is just part of that summary page. Okay, so when we, at the workshop and since then, when people have been thinking about getting the concept, the idea, the really early planning for their study or trial, one of the things that's come out very strongly is that it's really important to get early public and patient involvement and engagement, to get them involved in helping design your study even, and getting them involved in your grant application as well. And so some of the support that's available in Manchester, first of all, is with Manchester University Foundation Trust's Public Programmes team. So when you click on that link, it takes you through to their website, and it tells you the type of thing that they do. So that team gives advice, then they can help with the design and delivery of your project, and then they can undertake research and evaluation. And there's a contact point as well there. So that's one source of support that people have found really helpful. Another issue that came up as a big challenge was project management. Project management of your trial, really from the early stages all the way through. Sometimes it can be, one of the challenges was that it's difficult to get a consensus for all the collaborators. And likewise, if you're working by yourself, it's very difficult to find a forum to bounce ideas off people or to know, am I making the right decision? So a solution to that is the Research Project Manager Network. Now that's actually based at the university, but it's open to people working at the trusts or anybody involved in clinical research or research projects in Manchester. And it is a great network, a great forum for peer-to-peer support and advice. They run regular meetings and events, training, all sorts of things. And also, there's a really strong and active email distribution group. So if you have a query or a problem you're not sure of, research project managers who manage research projects have probably encountered a similar problem. So you can post your query to the group and you'll invariably get a reply. So it's a really good network and support there. And this website goes into all the detail about what they do as training as well. The other support area that's really good for early stage when you look at the concept is the NIHR Research Design Service. So this is a national, so let me just go back there. Actually, I've clicked.
Got the CTU.
I've come back to the Manchester CTU. So this is headed up by Kevin O'Brien at the moment. And actually, it's they're really reaching out to researchers at an early stage to see whether they can help you develop your application and help you with your trial design. And Kevin O'Brien is really happy to meet with people at an early stage to see whether your project is suitable for going through a clinical trials unit. Okay. Anyway, the Research Design Service is a fantastic resource here with lots of support, links to support offered by the NIHR for that. So just to finish this slide, another area that came out very strongly has been the provision of statistical support. And basically the message is it's really important to consult early on. And in Manchester at the moment, there are two places to go for support. One is the University of Manchester Biostatistics Collaboration Unit, which is part of the Centre for Biostatistics. And they are there to provide statistical expertise for grant-funded research. So you contact them and they advise on costing funding and whether they can help with your grant. And the other one is at Manchester University Trust, again, the statistical support offered by the research office. And if you click on that link, it takes you to the page, you fill in a form, and then they get back to you with their thoughts. Okay, and one of the other things I wanted to show you is governance and sponsorship. I just want to show you here really that there is lots of support available from the different trusts in Manchester, Manchester, Christie, the Salford, and the University of Manchester Clinical Trial Support Team. So each trust and university is a little bit different, and these links take you to their R&D offices page for governance and give you all the help that you might need there. Information governance has been an issue that's come up as a challenge, and the University of Manchester has a good website which should answer some of your questions there. Okay, so take your time to have a look around that document on the BRC website, try out the links and read through some of the challenges and solutions that people have had, and hopefully they'll be a source of support to you. Okay, I'm going to hand back to Jackie now and we'll go through a few questions that you might have.
Thanks, Zoe. So we've got a couple of questions from people who registered that they posted before we did the webinar. So the first one is a pretty broad one. It says, what support is available for the process of trial application and setup for researchers at the start of their journey? So hopefully to some extent we've answered that question and told you where to find more information about that. As I say, I can't stress enough that if you have a look at these pathways and just see what sort of support is there and what sort of things you need to do by looking through those checklists, hopefully it'll help avoid situations where you get down a particular route, setting up a trial, and then realise you've forgotten something that you needed to do at an earlier stage. The other thing to say is that our plan is that this is the first of many webinars where we can delve more deeply into the various bits of infrastructure available around Manchester to help support trials, but that we're also very open to suggestions. You'll find Zoe's contact details on the website, so feel free to drop Zoe an email with suggestions for webinars in the future. The plan at the moment is the next one's going to be about contracts, as something people have found
on the 16th of May.
Particularly challenging on the 16th of May, but we're very open to other suggestions as well. And I think we had a second question previously, so we had somebody say they were interested in developing a small group of research active people to provide early feedback and give guidance. And then they suggested on things like clinical and basic science, so clinical and basic science researchers, statistician, PPI, R&I manager. So I think what I'd say about that is, as you can see, if you take a look at the pathways, there's a lot of groupings and support out there already. And so I'd look carefully before thinking about setting up another group of your own to make sure that there isn't already an organisation or a group of people that exist that can help you. And if you are going to set up a group yourself, I think the important thing is to think very carefully about what purpose you want that group to serve. So it may be that you want scientific feedback about the studies you're doing, your protocol designs, and the science of the work, in which case it would make sense to link up with people working in a similar area. Whereas, for example, if you are writing grants or fellowships, there may be a value of pulling together quite a different group of people who perhaps come from other different research areas, because although grants are peer-reviewed by experts in the field, often the final decisions are made by panels who are non-expert, and it can be quite important to understand how what you're proposing is going to be viewed by people who don't have the knowledge in your field that you have yourself. So in terms of pulling people together, yes, we think that's a good idea. We are keen to support that kind of thing through the RTI, but think carefully about what the purpose of that grouping would be and what you want it to do would be my advice.
Great.
Okay.
Okay, so does anybody have a question at all? That's fine. Has anybody here in the room got a question? No? Okay. Well, anyway, just please take your time and have a look through the documents on the website and think about anything else that you'd like us to cover in these webinars in the future.
Absolutely.
Yeah. So, well, so thank you very much for joining us today. This will be posted on the BRC website shortly, so it'll be available to watch afterwards. And for all those who have taken an early Easter break and aren't here today with us, also want to have a look at it on the website later. And thank you, Jackie, for joining us. And thank you, everybody here, and thank you on the webinar.
Thanks.
Okay, thank you. Goodbye.